Hi everybody, my name is Julie Reed from the Working Body Massage and Personal Training. I'm here to talk to you today about tibialis anterior. Last week on Facebook I posted a diagram outlining all things tibialis anterior, and today I wanted to show you some ways to release the muscle if you feel like it's tight and ways to determine if you think it is tight. So, tibialis anterior, to review, originates at the lateral condyle of the tibia, the proximal lateral shaft of the tibia, and the interosseous membrane, which is the soft tissue between the tibia and the fibula. It runs all the way down to the base of the first metatarsal and the medial cuneiform. The actions of tibialis anterior are flexion and inversion. So how do you know if it's tight? Well, there's a couple ways. You can lift your leg, and if it looks rotated like this and flexed, so inverted and flexed, it's a little bit tight. You can also lay on your back and see how it appears whenever you take gravity out of the equation. Does it look like this when you're laying flat? So if it does, that means that it's concentrically tight. Concentrically tight means short and tight. So if you put your finger at the origin and the insertion and you do that movement, your fingers have gotten a little bit closer together. So it's a little bit short and tight. You can even see the flexion of tibialis anterior when I do this. I have a pretty well defined tibialis anterior. So how do you release it? It's probably going to be a little bit tender, so you know that you have to be careful whenever you're releasing it to not overly stimulate the muscle. And it's probably going to feel a little bit knotted. So a couple things you can do are self-care massage. As a massage therapist, I see this a lot in my practice, and I like to use this one particular technique called pin and lengthen. So go ahead and put a little bit of massage lotion on your hands, and you can start at the origin of the muscle. You can also start at the insertion, but we're not going to go that far, so maybe start at the origin and pump your foot like a brake. Go down that muscle. So a couple things to think about whenever you're doing self-care massage. One, you want to sink to the restriction and then start. As you pump your foot, it's going to help move your fingers along this muscle. You want to go to about 2 to 3 inches away from your ankle. Do this about 3 times until you start to feel a difference. You don't really have to put a lot of pressure into that muscle in order to see change. So, say you don't want to do anything like self-care massage. By the way, if you are doing self-care massage or any other technique trying to release a muscle, things you want to avoid are sharp pains, nerve-like sensations, anything that feels hot in your body, and anything that is way overly tender. In those cases, go ahead and see a professional, either a massage therapist or a physical therapist or a doctor if you are dealing with anything out of the ordinary or something that feels super uncomfortable. So, other ways to release your muscle. Grab a foam roller. This is very similar to the self-care that we just did. Go ahead and place it on top of tibialis anterior. And what you can do is pump your foot as you move along tibialis anterior. Same idea as self-massage, but you didn't need any lotion, and you might have a foam roller at the gym. You can do this after your workout. Again, a couple times. Lastly, grab a lacrosse ball. You can also use any other kind of ball. I like a lacrosse ball because it's small, it's pretty dense. And you can put it right on tibialis anterior. You're really going to feel some trigger points in here. Areas that are particularly tender, potentially referring outside of the area where there's pressure. Don't mistake a trigger point with a nerve pain. So anything that feels wrong probably is. You're just going to find a tender spot, stick around there for 10 seconds to a minute, and then move on. You don't want to spend any more than 2 minutes on one particular area. And usually my guideline is once it's less tender, move on from that spot and find another tender area. There are definitely enough tender spots on your body and this shouldn't take that long. Okay, so those are my guidelines for tibialis anterior. If you have any questions, please email me at julie@theworkingbodytherapy.com or visit my Facebook page at facebook.com/workingbodymassage. Thank you.